Teenage pregnancy. Teenage pregnancy is also known as adolescent pregnancy. It's a pregnancy in a female under the age of 20. Pregnancy can occur with sexual intercourse after the start of ovulation. So, teenage pregnancy is a common in our society, especially in this time of pandemic. Many young women have give birth at an early age, but they don't think what is the possible happen when they get pregnant at an early age. And in this time of pandemic, it's so difficult to find money or job so that they can provide their family's need. Young women and women they need to know the effect of women getting pregnant at an early age. So they need to have contraceptive like condom. So in that case, the woman then get pregnant if they do sex. And in this case, you need to be open-minded to know about these things or ideas. Teenage pregnancy is not easy. It's because you need to be responsible parents early. However, other women get pregnant at an early age. They abort their child because they don't know how to raise their child. So that all I can say is they need to be control themselves if they do sex, if they don't want them to be parents at an early age. And it's hard to live now because we face this pandemic. It's not easy to have a family at an early age. Unless you and your partner have job, it's fine. But when your partner and you don't have any job, it's hard to raise your child. So young women need to know that if they already have a boyfriend, do not take it easy to that matter because there are many responsibility things to do, and it will also destroy your dreams of life when you get pregnant at an early age. However, this is the percentage of how many pregnant women are in the world. According to the World Health Organization, approximately 12 million girls aged 15 to 19 years and at least 7,700 girls under 15 years give birth each year in developing regions. At least 10 million unattended pregnancies occur each year among adolescents girls aged 15 to 19 years in the developing world. Complication during pregnancy and childbirth are leading case of death for 15 to 19 years old girls globally. Of the estimated 5.6 million abortions that occur each year. Among adolescents girls aged 15 to 19 years, 3.9 million are unsafe, contributing to maternal mortality and morbidity and lasting health problems. Adolescents mothers aged 10 to 19 years face higher risk of eclampsia for partial endometriosis and systemic infection than women aged 20 to 24 years and babies of adolescents mother face higher risks of long birth weight, preterm and delivery, and severe neonatal condition. Adolescent pregnancy are a global problem occurring in the high, middle, and low income countries around the world. However, adolescent pregnancies are more likely to occur in marginalized communities, commonly driven by poverty and lack of education and employment opportunities. Several factors contribute to adolescents' pregnancy and birth. In many societies, girls are under pressure to marry and bear children early. In the less developed countries, at least 39% of girls marry before they are 18 years of age and 12% before age of 15. In many places, girls choose to become pregnant because they have limited educational and employment prospects. Often, in such society, motherhood in value and marriage or union and childbearing may be the best of the limited option available. Adolescents who may want to avoid pregnancy may not be able to do so due to knowledge gap and misconception on where to obtain contraceptive method and how to use them. Adolescents face barriers to accessing contraception, including restrictive law and policy. Regarding the provision of contraceptive based on age or material status, health worker bias and or lack of willingness to acknowledge adolescents' sexual health needs and adolescents' own inability to access contraceptive because of knowledge, transportation, and financial contrast. Additionally, adolescents may lack of agency or autonomy to ensure the correct and consistent use of a contraceptive method. At least 10 million unintended pregnancies occur each year among adolescents girls aged 15 to 19 years in developing regions. And additional case of unintended pregnancy in sexual violence, which is widespread with more than a third of girls in some countries reporting that their first sexual encounter was court. So, enjoy your life when you are young. Don't rush yourself into that matter because it will become in the right time in your life. And don't waste your time in that matter because if you do that, the time and day cannot be back. Don't curious about sex because when you try it, you make your life in the problem. So, as long as you are young, do the thing that you want as long as you can. But when you do the thing without any thinking about what will be possibly happen, it's too hard, especially both of you are not ready to be parents. In that case, don't waste your life and dream of that thing. Don't think about what was going to be happen now and what was going to happen in the future. That's all. Thank you so much.